Good morning, everyone. Thank you for joining us. My name is Suzanne Carowin. I'm Vice President of Marketing Communications here at the National Association of Insurance and Financial Advisors, also known as NAIFA. We are the organization that is the professional association for all insurance and financial security professionals out there. If you have a financial advisor, make sure they're a member of NAIFA. It's equivalent of being the good housekeeping seal of approval for financial advisors. So you wouldn't go to a doctor that's not part of the American Medical Association, probably wouldn't go to a dentist that's not part of the American Dental Association. So please look for the NAIFA, N-A-I-F-A sign and the logo to see that your advisor is a NAIFA advisor. Why is that? Because only NAIFA advisors ascribe to a code of ethics. You can find all of our NAIFA advisors at our consumer site at www.financialsecurity.org, where we have a host of other information as well and resources. Feel free to subscribe to our blog. So today's webinar is about Medicare and what's happening in 2023, what's new and whatnot, what you need to know. We're joined today by Sarah Gottschalk of Physicians Mutual. We're delighted to have her, and we're looking forward to a really informative webinar. With that, Sarah, I will pass it over to you. Thank you.
Hello, everyone. Thank you for having me today. My name is Sarah Gottschalk. I am an independent agent and I do represent Physicians Mutual. Previously, I was a paramedic on my local emergency squad for about 10 years. And during that time, I had the ability to transport people to the emergency room. And it always seemed to me that a lot of my patients would be more concerned with how their insurance was going to cover that trip to the ER or into the hospital, more so than their health at the time. And I always thought, what a terrible time to be thinking about if your health insurance is going to cover something. We are literally on our way to the hospital right now. And I also got to take patients to longer transports, maybe to a higher level of care. And I get to hear horror stories about how people couldn't get this test done or see this doctor or go to this hospital because their insurance wouldn't let them. And I'll be honest with everybody, if you would have told me about 10 years ago, I would have been sitting here today talking to people about Medicare and helping people with insurance. I probably would have laughed at you, but the older I get, I am in my 40s, I realize that the rising cost of healthcare is just crazy. And somebody can literally go bankrupt if they don't have the right policy in place. So today I help people mainly plan for retirement, especially with their Medicare, life and dental coverage, because Medicare doesn't always cover that. But today we're going to briefly talk about Medicare 101 and some of the changes that are upcoming. So give me just a second while I share my screen. All right, so here's my contact information if anybody needs to reach me. I am a Medicare benefits advisor. One thing I like to do is come from an educational standpoint to talk to people about the different parts of Medicare. So that when they're ready to move forward into Medicare, whatever their time frame might be, they're comfortable in knowing what they've paid into their entire lives. So you can reach me at 937-441-7438, or you can email me sarah.benefitsadvisor@gmail.com. Or you can check out my Physicians Mutual website there, and I will post this again at the end of the talk today. So here's a little bit of my paramedic years here. This is my local emergency squad and our 2 ambulances, and we were voted Volunteer Agency of the Year, and I was also Employee Member of the Year. So that was pretty exciting back from my paramedic days, but I am no longer practicing that. So let's talk a little bit about Medicare. Medicare is a federal health insurance program for seniors and other individuals with certain medical conditions and disabilities. So not necessarily someone having to be 65 to go on Medicare. They could be Medicare eligible prior to 65 if they qualify. It's often confused with Medicaid, which is a federal and state health insurance program for people with limited resources. So somebody can have Medicaid and not have Medicare. And somebody can also have both. So those scenarios definitely will change somebody's direction moving forward into Medicare if they're already Medicaid eligible. So the different parts of Medicare are Part A, that covers your hospital insurance. Part B covers your medical insurance. So Parts A and B are the foundation of Medicare, oftentimes referred to as original or traditional Medicare. So a lot of people choose to stay in Parts A and B and pay what Medicare has set up for costs as far as what A and B covers. For instance, there are deductibles with both A and B. There is a Part B premium that people have to pay into Medicare generally based off their their taxes that they filed for the past 2 years. For Part A, there can be a premium, but for most people who've worked for more than 10 years in their life, it's premium free. So if you stay on original or traditional Medicare and have Parts A and B, you can pay the cost that you'd be responsible for the cost that Medicare doesn't pay. So a lot of people choose to add a Medigap or a Medicare supplement plan, and we'll kind of talk a little bit about how those plans work a little bit later. An alternative to original Medicare or original Medicare and a supplement plan is Part C. This is privatized Parts A and B, also known as Medicare Advantage plans. And then Part D covers your prescription drug coverage. Generally, they're offered by standalone insurance companies. They have a monthly premium, and this is something that I help each of my clients look at and review every year. Medications change, formularies change, all kinds of things can change. So actually had the pleasure of speaking with a couple from California this week, and hopefully I'm going to be able to save the couple over $3,000 a year by looking at their drug plan and possibly switching their supplement plan. So it's very important to talk to a licensed agent. We're going to talk about that here in a second. One thing that Medicare does not always cover, Medicare does cover unlimited preventative benefits. So things like your mammograms, AAA screening, colonoscopies, those types of things. However, they will pay for some, but not all of preventative services. So doctors may recommend that you have a test more frequently than Medicare will allow. For instance, Medicare says they're going to cover a preventative colonoscopy once every 10 years or 120 months. So most times, if the doctor orders that test be done outside of that 10-year time frame, say they have a history of colon cancer in their family or are showing maybe some signs and symptoms, and the doctor wants to rule something out, lots of times the doctor just won't even order that test because they'll tell the patient that, Medicare's not going to cover it. You already had your first one. But I do want everybody to know that there are companies that are going above and beyond what other insurance companies are doing and Medicare is doing, and will cover unlimited preventative benefits. With this type of plan in place, clients and their doctors can now decide when and how to have their tests instead of on Medicare's timeline, because the insurance company will now pick up that cost for that test and it's no longer out of their pocket. And I really, really, really love and appreciate this benefit. If I could tell you stories about how many people I had transported back in my paramedic days that they couldn't get a test or afford to have the test, and their cancer spread throughout their body. And some of them had passed away and it had got too aggressive. And this is seriously something that can be life-changing for people to have access to unlimited preventative testing to rule anything out. And I absolutely love this. So if anybody has any further questions about what that looks like, please feel free to give me a call and we'll set up a time to chat about that. Why it's important for clients to consult with a licensed agent. My experience is that everybody's situation in Medicare is different, whether that's moving forward into Medicare or already being in Medicare. Now, an agent like myself will help the client develop their timeline as far as how and when to sign up for Medicare. That can get really confusing. So I walk my clients each through that and help kind of determine how and when to sign up for Medicare. And my goal is to address their specific needs for Medicare. So here are some instances where this is why it's really important for clients to talk to a licensed agent, because they could have employer coverage if they're working past 65. Can they stay on that plan? Can they not stay on that plan? Do they sign up for A and B then? Do they have a health savings account? These are all questions that I need to ask my clients in order to help them make the proper decision. Does the client have both Medicaid and Medicare? Those are completely different clients than most people. And depending on what level of MSP they might have, as far as a Medicare savings program level, I can determine what plans they would be eligible for if they have both Medicaid and Medicare in place. So determining what somebody qualifies for is also very important when it comes to if that person has Medicaid and Medicare together. Is the client already enrolled in Medicare prior to 65? In some states, you're only eligible to get in certain types of plans, but when that client turns 65, they're going to have a larger window of more comprehensive plans to choose from. And it's important to reevaluate with that client right when they're going to turn 65 to make sure that they know all the options and the doors that are going to be open for them moving forward and when those doors are going to close, because those doors will close. Somebody might have benefits through TRICARE for life, VA, or might be even offered a retirement package through their employer and could potentially risk not being able to go back to that employer plan if they decide to go a separate way. So again, that's something I would never want to mess with somebody. And I would be able to sit down and kind of reevaluate that employer plan versus what Medicare looks like and what their other options are. And they can make that decision then moving forward if they are able to not take that employer plan. Also, during my consultation, I help people with avoiding penalties. Did you know you can get a tax penalty if you contribute to a health savings account past the time Medicare requires you to? That's something big people don't know. If you're on an employer plan that's less than 20 people, that might not be considered creditable coverage, and you might get a penalty if you decide to stay on that plan past 65. Again, plans may not be available in the future. Like I was saying, doors close on people, and later on down the road, they might not be able to pass underwriting to get a more fruitful plan. And I've seen that time and time again, where people really need a specific type of plan, but they can't pass the underwriting to get it. And it is a terrible shame when that happens. I also provide a yearly plan review to make sure that they're in the plan that's giving them the benefits that they need, especially with their drug plans. This is something I help my clients reevaluate every year. Like I said earlier, prescriptions change, drug plans change, premiums go up, deductibles go up. Your medication might be a completely different price moving forward into the next year. And that's something I help each of my clients do every year. And I provide excellent customer service. So there's been times that I've been on the phone with the insurance companies, with my beneficiaries, or with Social Security, just helping them and guiding them along the way. And it can be really difficult for some people, far as having to navigate through that. And then, of course, we're going to assist them with the enrollment and application process and keep an eye on that and let them know if there's any snags or if it went through completely. So these are reasons that it's super important. If you're not working in the Medicare industry and you have a client who's got questions about Medicare, send them to a trusted licensed agent. People are getting bombarded by phone calls this time of year. And when they turn 65, it's hard to know who to trust because there are definitely some scammers out there. I'm only 44 years old and I'm getting scammer Medicare calls. So I can't imagine what that's looking like for my clients that are 65 years old. How frustrating can that be? If they have a trusted agent that they're working with, they can ignore those phone calls, ignore those solicitations, and ignore those mailers, and know that they have trusted guidance through their insurance. So let's talk about what's new and upcoming in Medicare. Again, this is presented by me. However, these are articles from the Medicare Rights Center. I did not write these articles. I joined Medicare Rights and joined their email list because they have some really great up and coming articles about Medicare. So again, not written by me. They are definitely written by other people. I'm giving them credit to as well. So all right, what's new in Medicare? So the first article by Julie Carter is there was an issue brief that outlines how and why people with Medicare choose between coverage options. So earlier we were talking about a supplement plan versus an Advantage plan versus original Medicare and what that looks like. So we'll touch on how that works and help people and why they make those decisions and choose what option to take moving forward. So we've got original Medicare versus a Medicare Advantage plan. This article was written a few weeks ago. The Commonwealth Fund released an issue brief on how and why people with Medicare choose between original Medicare and Medicare Advantage. The issue brief discusses the trade-offs between the options and how beneficiaries tend to rate them. So those who choose to stay on original Medicare have access to any provider across the United States, actually, who accepts Medicare and may save money by coupling original Medicare with supplemental insurance like Medigap. Medigap and Medicare supplement plans mean exactly the same thing, so don't get those confused because it's easy to do. Medigap and Medicare supplement plans are designed to fill in the gaps of what Medicare doesn't cover, depending on what specific plan they choose. Now, original Medicare does not have a cap on out-of-pocket spending, and benefits are limited. So just keep in mind, if somebody only takes original Medicare, the higher their hospital and medical expenses go, the higher they're going to pay out of their pocket. There's no cap on that. So it can be very dangerous for somebody who gets a lot of medical bills, is hospitalized a lot, or gets diagnosed with something really critical, to not just have original Medicare, to have something else in place, because there is no cap of what's coming out of their pocket. So for those with original Medicare, 40% cited they like that free choice of providers as the top reason. That number actually increased to 50% for enrollees with original Medicare and that supplemental coverage, because that supplement or Medigap plan will follow them to 95% of doctors, hospitals, and facilities across the United States. There is now no need for there's no network restrictions. You don't have to verify if a doctor is in the network, as long as the doctor or hospital accepts Medicare assignment. You can use original Medicare, and therefore your supplement plan will follow you and pick up those costs. So here's a little snip of how Medicare supplement or Medigap plans work. These are insurance plans to cover the gaps in Medicare that normally you would have to pay, or the beneficiary would have to pay. So the beneficiary's doctor or medical service provider bills Medicare for the service or procedure. Medicare pays their approved portion and then sends the excess amount to your Medigap or Medicare supplement plan. And then the plan pays the excess amount according to the terms of the plan which you choose. And there are a wide variety of supplement plans out there, and depending on when somebody's Medicare eligible, that determines what plan is at the top of their list as far as being the most comprehensive for them. So again, that's something that I would go in a little bit further when I do have that one-on-one consultation with my clients. So Medicare Advantage, this is the alternative, because you cannot have both. You cannot stay in original Medicare or stay in original Medicare with a supplement plan and have an Advantage plan. It is literally either or. Medicare will not allow it. So those people who choose Medicare Advantage do have an annual cap on their out-of-pocket spending. It's still quite high. The average in 2023 for Advantage plans is around $8,300. I've seen it vary. I've seen it as low as in the $2,500 ranges in some states. I've seen them as high as $11,000 out of pocket. Now, these plans also have access to additional benefits. However, Medicare Advantage plans often have networks that will restrict your choice of providers. Doctors come and go out of the networks. It's very hard to even sometimes verify on the carrier site if the doctor's in network. I've had that happen before, where the doctor leaves the network and the provider hasn't updated their site. So in that instance, people who had that plan and their doctor left that plan, they can pay full price to go see the doctor. They may have a PPO plan that would give them the opportunity to see an out-of-network doctor, but the doctor still has to accept the terms and conditions of that PPO plan, or they're left with finding another doctor in the network. So that can be really confusing and frustrating for clients when that happens to them. I've seen that several instances too. Here's a big one. The Medicare Advantage plans may impose what's called prior authorization or other restraints on access to care. And prior authorization is just a fancy term saying that your insurance company gets to decide if and when you're having that test. And that can take a long time to get approval with that prior authorization. And then they could deny you that access to care. And that's really frustrating, heartbreaking for a lot of people who feel like they need that access to care. We'll talk a little bit more about prior authorization later on down the road, but it is important for you to keep that in mind that with Medicare Advantage plans, it basically is a fancy term for you got to get permission for some things. Also, with Medicare Advantage plans, they generally have very limited extra benefits and may ultimately cost more than the combination of original Medicare combined with the supplemental plan or Medigap plan. And that's because that max out of pocket, could be quite high, average of $8,300. So again, I like to paint the picture with my clients and kind of help them decide what type of plan they want to pick moving forward. And that's their decision, what they decide. So here again is a little snip about how Medicare Advantage or Part C, it means the same thing, how it works. They are private health insurance plans approved by Medicare. They have to combine Medicare Parts A, Parts B, and often Part D in one plan with a network of providers. And they do have to cover the same things that original Medicare covers, but oftentimes it's not as good as coverage as what you would get with a supplement plan. And that's something that I like to definitely talk with my clients about so they understand what. So 24% of those who opted for Medicare Advantage plans were drawn by the extra benefits like the dental, vision, hearing, maybe over-the-counter benefit, those types of things. And another 20% citing they like that out-of-pocket cap. People with lower incomes were more likely to find the extra benefits appealing, but people with both Medicare and Medicaid were less likely to choose Medicare Advantage for the extra benefits than were people with just Medicare only. So I found that pretty interesting. Lots of times when I speak to my beneficiaries that have Medicaid and Medicare, they don't understand that there are some plans out there that are going to give them some really fruitful extra benefits. And usually they're really excited when I tell them what they're eligible for, and they are really pumped to know that they can get some really lot more extra benefits than they were used to. So, do you have a confused beneficiary? It happens all the time. Most people who receive help choosing between their coverage options turns to brokers or agents. And this was another thing I found really interesting, but these individuals are not always objective. They receive commissions which may not be equal between products. And I found that really interesting. And of course I know that, but I find myself to be pretty ethical, and I want to come from an educational standpoint and let my beneficiary know all the ins and outs, and not just the rainbows and butterflies of a plan, but also the train wrecks and car wrecks, so that they can feel confident in their decision moving into Medicare. For example, commissions currently are higher for Medicare Advantage plans than for supplemental coverage like the Medigap or Medicare supplement. This may create an incentive for agents and brokers to steer consumers into Medicare Advantage plans, and not even talk about how Medigap policy can possibly be more fruitful coverage for them. So again, I come from an educational standpoint, so you're going to hear both sides and both points of the story. Still got a confused client. I understand that. The brief shows that marketing by Medicare Advantage plans is a major source of information for many consumers, and we're seeing them all over TV right now. Such marketing is not objective. It only touts the benefits of Medicare Advantage and not the trade-offs. So I'm sure we've all seen those commercials. I think there's an Angry Gertrude out there this year. Joe Namath's talking about them. I think Lionel Richie is another spokesman for Medicare Advantage plans, and it talks about the great benefits of it, but it doesn't really paint the picture of what happens to you if you go to the hospital. How much are you going to be subject to pay each day, or what's going to happen if you have to go to rehab for a skilled nursing facility? What does your Advantage plan say you're going to have to pay out of your pocket? And those costs could add up. So I don't ever want my clients to be blinded by the bells and whistles. They have to know, what they're up against financially moving forward, because Medicare is really the last step for all of us as far as health insurance goes. for the majority of us. It's Medicare's the last insurance we're going to get. So it's important to make that correct decision for yourself at 65, 70, but you also have to think about your health at 75, 80, 85. My great grandma lived to 103, so you never know. And you want to make sure that, you're set up for yourself as our health fails, later on down the line. So there have been complaints about misleading marketing, and they are on the rise as TV ads become more prevalent. This points to the need to extend and improve information access about the pros and cons of original Medicare and Medicare Advantage plans to ensure people are getting the full picture. So that is super important. I am glad they pointed it out, because people just get super confused, and it's important for them to know, that maybe we just don't look at the marketing of it, because it can be misleading for sure. So the extra benefits of Medicare Advantage plans that many find appealing are also problematic, because little is known about their delivery, and any that provide high quality care should be available to anyone with Medicare. It's vital that Medicare Advantage plans not be permitted to funnel overpayments into supplemental benefits that in turn lure people into Medicare Advantage plans. So again, there definitely is some overpayment, and we're going to be talking about that later on down the road. For most of you who know, who are aware, it is definitely the annual enrollment period is happening right now. That Medicare's annual open enrollment period started on October 15th. It will end December 7th, which means millions of people with Medicare are scrambling, grappling, trying to find their coverage, make their coverage decision. Choosing between original Medicare and a Medicare Advantage plan is literally just the first step. People who opt to remain in original Medicare still need to explore options around Part D prescription drug coverage. They can get a penalty if they don't have a prescription drug plan later on down the road. So we want to always avoid that. Also, they need to reevaluate their supplemental insurance, like their Medigap or Medicare supplement policy. Maybe they can still add that on to their original Medicare. Those who choose the Medicare Advantage route must determine which plan is best. Medicare Rights Center encourages all people with Medicare to consider their health care needs and access whether they're in the best coverage for their circumstances. So with that being said, right now everybody's looking and checking out to see, if their doctor's still in the network, if there's a more fruitful plan available out on the market, and those types of things. So that's what's happening till December 7th for all of us in the Medicare industry. If your client needs help with Medicare coverage, they can contact their local state health insurance assistance program, or SHIP, for unbiased one-on-one counseling. They can also contact Medicare online at www.medicare.gov, or by calling 1-800-MEDICARE. Medicare.gov is an excellent resource. Do not go to Medicare.com. Make sure you're going to the government's website, Medicare.gov, or they can call the Medicare Rights Center National Helpline at 1-800-333-4114 and get some additional information there. If you'd like to read the full article, I can post these possibly in the chat after we're done talking. If you want to read the full article. Right, sorry about that. Let me shut that off real quick. So the next thing we're going to talk about, the next article, is written by Lindsay Copeland. This is important rules implement key Benny's Act provisions to simplify Medicare enrollment. So some changes to how people are going to be enrolling in Medicare. So they have made this effective January 1st of 2023, and this is going to be a nice change for people that previously would not be able to get enrolled in Medicare if they had missed that time frame. So on November 3rd of this year, the CMS finalized rules implementing the beneficiary enrollments. Notification and eligibility simplification, also known as the Benny's Act. These policies were signed into law as part of the Consolidation Appropriations Act of 2021. Some of these landmark provisions include, sorry about that. That's weird. All right. Eliminating the month-long wait for months-long wait for coverage that occurs when people enroll during the general enrollment period or in the later months of their initial enrollment period or IEP. So beginning in 2023, Medicare coverage will begin the month following enrollment. So no longer will these people have to wait. They can get it the month following the enrollment. Also giving Medicare the authority to establish Part B special enrollment periods or SEPs for what's called, quote, exceptional circumstances. Flexibility long available within Medicare Advantage and Part D. So if somebody wants to change their Part D plan or Medicare Advantage plan through outside of the annual election period, they have to have a special reason in the eyes of Medicare. You can't just go flipping plans without Medicare's approval. So starting in 2023, people who qualify for Part B SEP can enroll without having to wait for the general election period and without being subject to a Part B late enrollment penalty. So that's great that they're eliminating some of these penalties. So here is one that has changed this year. Well, actually for next year. This is the special election period for disaster. So that's going to be instead of 2 months, it's going to be increased to 6 months. So this is a special election period for individuals impacted by an emergency or disaster. As proposed, this would have applied to only beneficiaries who missed an enrollment opportunity because they were in an area affected by a government declared or FEMA declared disaster or emergency. So now this SEP lasts 6 months rather than the 2 after the end of the emergency declaration. This is a big one too. It also expands the SEP's availability, allowing individuals to use it if the disaster or emergency occurred where their authorized representative, their legal guardian, or the person who helps them make their healthcare decision, the place where they might live. So that also is a big change for people to be able to have like their power of attorneys, even if they might live in another state. You know, if that person lived in an area that had a FEMA declared disaster or emergency, you know, they could use that SEP disaster then, whereas previously they had it was the beneficiary and their place of residence only. So that can really be helpful for people who need to make that change. Here's another SEP for misrepresentation has now been moved from 2 months to 6 months. So this is an SEP for health plan or employer error that constitutes as, quote, medical misrepresentation of information related to a timely enrollment. The proposed rule sought to provide relief in instances where an individual could demonstrate that their non-enrollment was due to a misrepresentation or incorrect information provided by their employer or health plan. Again, it's been extended by 4 months. It will now last 6 months after the individual notifies Social Security Administration about the misrepresentation. It makes this notification process less burdensome by permitting the beneficiary's written attestation to suffice when the documentation from the employer or health plan is not available. So it makes it a lot easier for the beneficiaries to prove that, you know, they were misinformed. And this is a big one. It also expands the sources of misinformation to include plan brokers and agents. So not only for the health plan or employer error, but also an error from the brokers and agents that they may have spoken to. So that's a nice little addition there. All right, SEP for incarceration has now been extended from 6 months to 12 months. This is an SEP for formerly incarcerated individuals to enroll in Medicare following their release from a correctional facility. So again, we're going from 6 months post-release to now 12. To reduce the risk and gaps of coverage, it allows qualifying individuals to choose between retroactive coverage going back to their release date, not to exceed 6 months, for which premium payments would be owed, or coverage beginning the month after they enrolled. So you can get that can be, they can choose that retroactive coverage, or, the month following after they sign up for A and B. All right. This is an SEP that I do believe is going to be used frequently. That's my personal opinion. This is the termination of Medicaid is now going to be retroactive. So this is a special election period to coordinate with termination of Medicaid eligibility. This is particularly timely of finally flexibility given the inevitable wind out of the COVID-19 public health emergency. So my personal opinion is I think a lot of people are going to be losing their Medicaid eligibility, and they're going to be using this SEP. So to minimize access problems, the final rule permits that affected individuals choose their coverage effective date, either retroactive to their Medicaid termination, which January 1st of 2023 at the earliest, and then premium payments would be owed for this backdated period, or beginning the month after enrollment. So that's going to give them a little bit flexibility if they're going to be losing their Medicaid eligibility. Here's another SEP for what's called exceptional conditions. This is an SEP for other anticipated exceptional conditions. It will last 6 months, but CMS will retain the ability to provide a special election period on a case-by-case basis. So basically, it's fancy words for CMS has to approve your reason. So on a case-by-case basis for other unanticipated situations that involve exceptional conditions. Again, the final rule provides a minimum 6-month SCP duration. Now, this is not a special election period, but this is actually really critical for people that are getting immunosuppressive drugs. This rule is not just released to the Bennies Act. It additionally formalizes a new Medicare Part B immunosuppressive drug benefit that was also created by the CAA. This policy allows certain people with Medicare due to end-stage renal disease or kidney failure, those who have no other insurance or Medicare eligibility and are 36 months post-kidney transplant and therefore set to lose their Medicare. Now they can still get access to continued immunosuppressive drug coverage through Part B. Eligible individuals can now enroll. So those people that have kidney failure, that have that transplant, that need that drug access are going to be able to have access to those drugs. This program begins on January 1st of 2023. A monthly premium does apply. I don't know anything about that. And people who are eligible for the Medicare Savings Program can also can access the cost sharing as well. So that's great news for people. I'm sure that if you're set to lose your Medicare and you've got kidney failure and you all of a sudden get a notification that you're going to go out of Medicare, this can be terrifying for people, especially those who need those immunosuppressive drug therapies. So that's also great news. If you'd like to read the full article, you can go to Medicare Rights Center. It's important rules implemented key Bennies Act provisions to simplify Medicare enrollment. And if Suzanne wants me to post the links in the chat after the webinar, we can definitely do that as well. Okay. The next article written by Lindsay Copeland is CMS to release audit findings on overpayments to Medicare Advantage plans. And I found this very interesting because the cost of healthcare to me is a huge issue. It upsets me. It's there. I feel like sometimes there's definitely some flaws in the system that create the cost for us to be a lot higher. So I found this article very interesting, and I just wanted to point out, what that audit findings produced for us. So, look at this: $600 million in Medicare Advantage overpayments. So, the Center for Medicare and Medicaid Services, or CMS, has agreed to release the audits of 90 Medicare Advantage plans conducted between 2011 and 2013. We've got a 2-year time span here. The records are expected to detail more than $600 million in Medicare overpayments due to, quote, upcoding which would be plan abuses of patient categorization rules. So upcoding, one reason, upcoding. Access to this information was the subject of a lawsuit filed by Kaiser Health News against the agency in 2019 under the Freedom of Information Act. So, as a share total Medicare spend, as a share of total Medicare spending, payments to Medicare Advantage plans increased from 26% in 2010 to 45% in 2020 and may reach 54% increase by 2030. By itself, upcoding could cost Medicare, look at this, $600 billion, not million, $1 billion over the next decade. Let that sink in. Upcoding, one problem, could cost Medicare $600 billion over the next decade. That's insane to me. At the same time, Medicare Advantage enrollment more than doubled over the last decade. The share of beneficiaries enrolled in Medicare Advantage, now at 48%, may hit about 61% by 2032. So in 10 years, we're going to increase to 1%. There is definitely a need for intervention, and I am a full believer in this. Policymakers must intervene. Inflated payments to Medicare Advantage plans require robust reforms, including updated payment methodologies, better data collection, and stronger plan oversight. And this, we can't stop just at that. Research has long shown plans also regularly seek, listen to this, to pad profits by stinting on care. Did we all hear that? Plans also regularly seek to pad profits by stinting on care, which means somebody's getting rich while our loved ones and people on Medicare aren't getting the care that they need and deserve. So each year, I told you we were going to talk about this later on, prior authorization and inappropriate denials leave millions with high cost and care delays. And beneficiaries are trying to navigate through such denials, but I mean, logically, most are going to be upset if you get denied care. I would be. I know I would be if my mom or grandma did. And they're very confused about what to do next. So despite sky-high overturn rates, because a lot of times if you try to get that prior authorization overturned, most just avoid that because it's very intimidating appeals process. Instead, they either pay out of pocket, they suck it up and pay it out of pocket, they go into debt, or they go without the care entirely. And it's very difficult to come from a background where you were trained to save somebody's life, to go to a career where somebody might have to choose between how much their life is going to cost and if they can actually pay for the care that they need, or go bankrupt, or go without it entirely. It's devastating for people. Even successful appeals come at a cost, and that also creates a delay in access, and administrative burden. So, I really need to really watch this prior authorization thing. If anybody has more questions on it, they can always reach out to me after the seminar here. So what needs to change? Medicare Rights Center urges a thorough restructuring to deter overpayments. They want to equalize Medicare benefits, realign payment incentives, ease access to care, including by limiting prior authorization and preventing those denials, and streamlining the appeals process and make it easier. I've heard a lot of complaints where people couldn't get the tests that they need, couldn't get to see who they needed to see. And I could see how difficult and how trying that was for not only the beneficiary, but for their family members too, who, believe that they should have access to that care. And I firmly believe this last statement: all people with Medicare deserve a system that works for them, regardless of the coverage pathway they choose. And I fully agree with that. Don't want to put a price tag on someone's life. If you'd like to read the full article, it's posted here, but I can also post that in the chat afterward. All right, and we're going to talk about now the final article. The Inflation Reduction Act fact sheet outlines important changes for 2023 and beyond. And I'm super excited to be telling you guys about this. These changes for 2023 and beyond that are going to occur in the next 10 to 12 years are really going to make a lot of my personal beneficiaries super happy. Again, this article was written by Lindsay Copeland. So, inflation reduction. This is a new Centers for Medicare and Medicaid Services fact sheet, outlines key Inflation Reduction Acts, or IRA, Medicare changes and effective dates. Now, this little bottom portion was taken from CMS.gov and an article they had posted here, and the first article as a link. So I just added that in here. This article comes from the Inflation Reduction Act, lowers healthcare costs for millions of Americans. So through this Inflation Reduction Act, President Biden is delivering on his promise to lower prescription drug costs, make health insurance more affordable, and make the economy work for working families. This means millions of Americans across all 50 states, the United States territories, and the District of Columbia will save money from meaningful benefits like lower prescription drug prices and Medicare through price negotiation with manufacturers. A yearly cap, $2,000 in 2025. That's going to be life-changing financially for some of the people that I talk to that, their medications can cost, $3,000-$4,000 a year out of their pocket. So a yearly cap in 2025 is going to be $2,000 on out-of-pocket prescription drug costs in Medicare, and then continued lower health insurance premiums through healthcare.gov and the state-based marketplaces. So that's a little snip from what that looks like as far as the Inflation Reduction Act from CMS.gov. But let's talk about going back to the original article. Here are the highlights of what's going to be updated. So key prescription drug affordability highlights include in 2023, and I've already seen this for next year's drug plans, insulin will be limited to $35 for a month's supply. Great news for our insulin-dependent diabetics. This takes effect January 1st for insulin covered under Part B and July 1st for insulin covered as durable medical equipment under Part B. In 2024, low-income assistance will be expanded to people with an income at or below 150% of the federal poverty level. This is great news for people that are on the fence with getting extra help or LIS assistance from Social Security. More people will have access to this and be able to get help with their medications through the LIS or extra help program with Social Security. In 2025, Part D enrollees will have their out-of-pocket drug costs capped at $2,000. This is great. They will also have the option to pay these costs in monthly amounts rather than wham bam all at once. So that's great. Some structural changes. CMS also expands the IRA's Part D structural changes. So in 2024, this is huge. People who reach the Part D catastrophic phase will no longer have to pay cost sharing. That's fantastic. Then in 2025, the manufacturer discount program in Medicare Part D will replace the Medicare coverage gap discount program. In general, it will require drug manufacturers to pay a 10% discount on certain drugs in the initial coverage phase, 20% discount in the catastrophic phase. Government reassurance in the catastrophic phase will decrease from 80% to 20% for most brand name drugs and from 80 to 40% for generic. So again, I'm really liking these changes that are upcoming. Timelines for these changes. So the initial Medicare negotiation implementation timeline in 2023, CMS will announce the first 10 Part D drugs to be negotiated. They must be among the highest spending brand name drugs that don't have competition. I love that. There are some that I've already got in my head that I'm like, oh, I hope those are on the list. 2024, CMS will publish the negotiated prices for those 10 drugs. Then in 2025, Medicare will negotiate prices for 15 more Part D drugs. Then in 2026, the negotiated prices for the initial 10 Part D drugs will take effect. This is the first year people with Medicare will see the direct impacts of the negotiation. CMS will then select another 15 drugs under Part D or B for negotiation. And then 2007, negotiated prices for those second 15 Part D drugs selected in 2025 will kick in. Each round is cumulative, adding to the total number of drugs with negotiated prices. CMS will announce then another 20 more Part B or D drugs for negotiation. Then in subsequent years, CMS will continue negotiating prices, which will take effect 2 years later. So in 2028, prices for the 15 drugs selected in 2026 will go into effect. Then CMS will announce 20 more Part D or B drugs for negotiation. And in 29, those 20 drugs selected in 2027, those prices go into effect. CMS will then announce 20 more Part B or D drugs for negotiation. Then in 2030, the 2028 prices for those 20 drugs will go into effect. And then in 2031, the 20 drugs selected in 2029 prices will go into effect. So I think that's fantastic that they're negotiating some of these prices. I've helped a lot of clients lately, especially during this AEP, with some super expensive medications that are just astronomical for them. So hopefully they'll be able to see some of these changes and benefit from having a little bit more money. A lot of people that I talk to are on a tight budget with only having Social Security. So these changes are just going to really, really help them have a better quality of life financially. So super excited about it. So that is the end of my slideshow today. Again, I want to thank you all for having me here today. I really appreciate it. I love getting out into the public and talking about Medicare. If you have any questions or have a client that you want to send over my way, please give me a call. My phone number is 937-441-7438. And you can also email me at sarah.benefitsadvisor@gmail.com. or go to my website, www.physiciansmutual.com/web/agent Sarah_Gottschalk. Thank you very much.
Thank you, Sarah, so much. And if you can go ahead and send me the articles that you mentioned, I'll go make sure we get it out to all of our attendees, and we'll post it on our consumer site at financialsecurity.org. With that, I hope everybody has a great day, and thanks for joining us. Look forward to seeing you soon.